Can mitochondrial donation be used if the patient has a few eggs or they are of poor quality?
Yes, mitochondrial donation can indeed be used in cases where the patient has a limited number of eggs or poor quality eggs. For women with low ovarian reserve or poor egg quality due to advanced maternal age, mitochondrial donation offers a way to bypass defective mitochondria while still using the patient's nuclear DNA. This allows the woman to have a genetically related child with the egg donor's mitochondria providing the necessary function for cellular energy, while IVF can be used to help with other fertility challenges.
Will the child inherit any characteristics from the egg donor?
The child will inherit mitochondria from the donor, but not nuclear DNA. This means that the child will not inherit physical traits such as eye color, hair color, or other genetic characteristics from the donor. However, they will inherit the donor's mitochondrial DNA. Mitochondria are crucial for energy production in the body, so the donor's mitochondrial DNA will influence cellular health, but there will be no genetic resemblance to the donor in terms of physical traits. Studies have shown there is a small amount of mitochondrial DNA passed out from the donor to the baby.
In which cases and for what types of patients is mitochondrial donation recommended?
Mitochondrial donation is recommended for women who have fertility challenges linked to poor egg quality or mitochondrial dysfunction, particularly those of advanced maternal age. As women age, the quality of their eggs naturally declines, often accompanied with mitochondrial dysfunction, which can impact embryo development and reduce the challenges of a successful pregnancy. Mitochondrial donation helps address the issues by providing healthy, functional mitochondria from an oocyte donor while preserving the woman's own DNA. It's also a valuable treatment option for women who have faced difficulties with traditional IVF, especially if they have experienced multiple failed cycles to have low ovarian reserve. Mitochondrial donation can be a way to increase the likelihood of a successful IVF outcome by improving the overall health of the embryos.
What are the success rates of mitochondrial donation treatments?
For most of our patients for whom mitochondrial replacement treatment is recommended due to their age changes, who are over 40 and mainly over 45, we have approximately 50% as the outcome of the euploid blastocyst formation and a 50% success rate for the clinical pregnancy. However, it's very important to know that these are several other key factors that can influence success, such as number of the oocytes which patients is able to produce, the quality of their oocytes, the state of their endometrium, and the overall health of the uterus. While these success rates are promising, each patient's situation is unique, and we work closely with each patient to optimize their chances for successful outcome by carefully considering all factors involved in the treatment.
How does mitochondrial donation affect embryo development?
The advanced maternal age is coming with a diminished ovarian reserve, also less number of follicles and low apoptotic mechanism in the follicle. That's why oocyte quality is dropping. So mitochondrial transfer is helping to use patient own nuclear DNA, while with the active mitochondrial DNA and good cytoplasmic and morphological structure oocyte, which is helping to develop better quality and morphokinetic of the embryos. So here the main point that we are still keeping 99% of the nuclear DNA from patient. However, we are using active mitochondrial DNA, which is producing more ATP energy and helping to develop embryos morphokinetically much better.
Is mitochondrial donation safe, and are there any potential side effects or risks for the child born using mitochondrial donation treatment?
The first baby from mitochondrial transfer already 14 years old. My personal experience, first baby I got already 7 years old, and there are many more baby published and reported all around of the world. So mitochondrial transfer, in the main point, we are using the donor which has very high efficiency, already own child, which we made the carrier screening, and which we know that donor has at least 2 successful cycle with the donor eggs with the recipients. So this making secure, much more secure, the mitochondrial transfer comparing even egg donation, while in egg donation you are using mostly young egg donors and with blind infertility status. So mitochondrial transfer is giving high quality and potential of embryo, but in a site also the donor has released from any kind of mitochondrial disease. That's why you cannot find any reported cases all around of the world which babies came from mitochondrial transfer has any mitochondrial disease or issue.